leadership at La Posada began to realize that the desire for skilled care facilities was beginning to decrease, they didn't just sit around and fret about what the future held. Instead, they stepped up to the plate and created their own future by transitioning from skilled care to a program of enhanced high-acuity assisted living.
Our decision at La Posada to transform from a skilled nursing facility into a high-acuity enhanced assisted living, it came about because for years we had experienced low occupancy. We're in a rural market. We only had a 58-bed skilled nursing facility, and many of those rooms were semi-private. So we knew we had to find something that would provide for them in a way that would do those things. And I think the model that we found has really, in fact, been able to fulfill those concerns and obligations.
When we started looking at the overall plan, we looked at, number one, what types of services we could provide. We looked at the nature of our residents, what kind of services they needed. We looked at the licensure. We talked to a lot of stakeholders. We talked to internal stakeholders as well as external. We talked to the Department of Health and our medical director. And it became apparent that we thought we could offer a higher acuity assisted living model and still take care of our residents. We then looked at the caregivers. We had certified nursing assistants in the nursing home, and we had to come up with a plan for making a switch to having CNAs become certified assisted living caregivers. So we investigated schools, education, how could we go about training 30 or 40 individuals at once, because our plan really incorporated making this change almost overnight. One part of the plan that we really wanted to cover was that we knew it was important and a little bit unique to us that we offered a very robust case management service. So if we were not going to be taking residents directly from the hospital, we wanted to have the ability to offer a case manager going out to see them where they were and keep that connection or that tether back to La Posada so that residents felt very connected.
Part of what we do for our residents who cannot have rehabilitation here on campus is I provide a daily visit to them in Tucson or wherever it is that they are receiving their rehab. Our residents are very loved here on campus, and they're very used to a certain lifestyle. And what my job is to bring them a small piece of that lifestyle so that their recovery is maybe a little bit better for them, even though they're not on campus. Each one of our residents that are here are very special. So we took our semi-private rooms, we turned them into suites, and we made 39 private rooms for our residents. When the residents actually transitioned on the 27th of December, we anticipated at least a year before there was any type of change to capacity. That change actually took 60 days, and we were at full capacity.
Well, the successes have been that after a year, this program is going strong. We're getting lots of attention. We're doing what we set out to do, which was to provide the top-of-the-line service that we can to our residents within an assisted living model, which was the goal. So we've done well at that. We've managed to move a culture along from skilled nursing into assisted living. We've had some financial success. It's gone well that way, so all of those have been positive. The resident satisfaction here is maintained an incredibly high number, and I think that's all because everybody here, all of the leadership team through to our caregivers, goes out of their way every day to personalize what's going on and to make sure people understand. So we've really kept a personal touch, and that's made a big difference.
The results of the hard work by the staff at La Loma is evident. Please join us as we congratulate La Hacienda at La Posada as the recipients of the 2015 Best Practices Award.